Hello and welcome everybody to this Preparing for COVID-19 webinar. Apologies, we're just a couple of minutes late this morning. My name is Troy Allen. I'm the Executive Manager of Casual Staff Services here at OnCall Group Australia. We're thrilled to have you all attending today, and hopefully we can provide you an insight into what it's like living with COVID-19 in your disability services environment. Today joining us, we have Laura Green, who's our General Manager, Ella Joyce, who's our Senior Service Delivery Manager, Kim Robinson, our Quality Manager, and Megan Cook, who a lot of you may know, who's our Operations Manager. So yeah, as the borders are opening up into Queensland, we've already seen a little spike, an increase in COVID-19 cases entering the state, and we felt it would be ideal to just share our experiences in Victoria, both managing confirmed COVID cases and also precautionary cases in disability services. We hope that today will provide you with an overview of our learnings over the past 18 months in Victoria and our operations managing and responding to COVID-19 outbreaks in our services. You will notice at the bottom of the screen there is a chat button, so please feel free to utilise that. If you have any questions, ask away. We have got set aside 15 minutes at the end of today's session to answer any questions. But as I mentioned earlier, Megan Cook is on the line, so if you need her details again, please let us know and we can share you her email and contact number and get in touch with her after today, and she'll be more than able to support and answer any further questions you have around anything relating to COVID-19 and supporting you in your services. So yeah, without further ado, we'll get the session started. First up, we have Ella Joyce and Laura Green just talking about being prepared and how to manage COVID in your site. So I'll hand over to them now. Thank you.
Thanks so much, Troy, and thanks everyone for tuning in and being able to take on some of the information. It might feel like what happened in Victoria is not going to happen in Queensland, but we really hope that by getting very practical and very much about what the day-to-day experience feels like, there might be a few gems that will help with preparation or even just ease the concerns and that can arise around COVID. We'd like to just start with talking about why OnCall, why we might be well placed to come and share some information with you today. So what's unique about OnCall in our Victorian operations is that we supply workforce to most of the disability and child, youth and family sectors. We also happen to be a registered provider of services ourselves. And so that puts us in a unique position of making a significant contribution to what became called surge workforce and generally the crisis response relating to COVID-19 right across the state of Victoria. It also means that we had our very own experience of COVID-19 in our services, and we can speak from both of those perspectives today. OnCall has a philosophy of being a problem solver and working in a team no matter what role we happen to turn up in and find ourselves in. That was really critical to how we contributed to government working groups. We joined with other CEOs and service delivery teams. We supported and contributed to practice leadership and turned up in a variety of outbreaks, whether they were in OnCall services or where we needed to supply staff to somebody else. That means OnCall, it has very leading and very, very practical experience. In fact, it's over 10,000 hours of supporting people with COVID-19 when we add up what happened right across 2020 and 2021. So my phrase is that at OnCall, we don't live with COVID, we deliver services with COVID. And we worked out early on that it was really important to be very open to share information for the benefit of the industry. And we're really pleased that now we're here, that we can do that once again with you today. So from my perspective, it's being really honest about what COVID means. It's not the actual positive case of COVID, but COVID as an idea and a problem that needs to be solved. We can be really upfront to say that COVID is distracting and it's a really difficult problem to solve. That means the preparation is really important to know what resources you might have at hand and will be available at any time, who might be involved, and the key stakeholders who are likely to be impacted, to have done that thinking in advance. We learned a few key lessons over the last 2 years, and they really boil down to 3 things. Collaboration is key, and you can ask for help, but you should also give assistance wherever you can and however you can. That honesty is key, and the more information, the better, even if it's to say there's things you don't know yet, like where a person contracted COVID or the timeline or something about that's going on, because every little input informs risk-based decisions, and that risk and timeline is really dynamic as well. And that goes to communication being key. Whether it's before, during or after an outbreak, you just need to tell everybody everything about what you're working on, how you're doing it. I think the communication and stakeholders is more exhausting than the COVID management in a lot of ways, but it's really mission critical to being successful as well. I think the final lesson is that we learnt there is a really big difference between a battle plan and battle, whether that was at OnCall or whether it was any of the, I think in the end, maybe 25 providers that we went and assisted in various situations relating to COVID as well. So I'm really pleased to be here today, sharing some of that with you and answering any questions. But I'm also really proud to be on the panel with some of our best and brightest who can tell you what it was like really down in the trenches of battle, but also what wasn't scary about it, what was surprisingly collaborative, and we were able to see people shine at their very, very best. So I'm actually going to hand over to Ella. Now, Ella's going to tell you a little bit about what it means to live through an outbreak, how to prepare. And we're really lucky that Ella came to join us in 2021, because in 2020, we actually worked side by side with her when she was employed with another provider, a really large not-for-profit. And that's a huge experience to benefit OnCall, but more importantly, to benefit everyone on this call today, so that you can hear a little bit about what it looks like from various angles and different situations. So Ella, maybe if I think about the battle plan, you can think about the battle. So tell us a little bit about what that was like.
Thanks, Laura, and thank you for your very kind introduction. So look, I will first state that I'm using the terminology of resident and house, but at any time as I go through this, you can interchange those words for client or customer, or the relevant term that you use for the person or persons with disability that you're supporting. So here in Victoria, COVID has kind of just become part of our business as usual. I, along with my esteemed colleagues on this call today, have been living this for 18 months. But if I think back to 2020, in that June-July period when Victoria was hit really hard by COVID, it's important to acknowledge that the thing that was most prevalent was fear. People were really scared. Residents and staff were scared for their safety and well-being, and families were scared for what it might mean for their loved ones. So while I'm going to talk about some of the practicalities of your approach, I can't emphasize enough the need for calm and empathetic communication with everybody. In short, you need to choose your support team really wisely. So first thing to think about is, who do you have on your team that's good in a crisis? Because these are the people that you're going to want to lead your response. It's also prudent to have some conversations with your teams of staff now, because that will help you to understand who's going to be prepared to work in a COVID suspected or positive environment. And some of the things that you can ask them to consider are, would they work in their own service if someone were a suspected or positive case? So are they comfortable to work in that service? Or would they be comfortable to work in another service? Because what we experienced was some people went, you know what, I'm happy to go wherever I need to be. Other people kind of went, I just need to stay in my own space because I feel comfortable in that space. And if they're prepared to work in other areas, which geographical locations are they prepared to go to? Because that will help you do some of that mapping in preparation. Make sure you develop a register of the staff so that when, and I do say when, I'm sorry, but I do say when, you do have COVID that requires their support, you can easily call on them. You've got their details ready to go on hand. And I'll talk a little bit more about some of the preparedness and training that they can go through in a moment. But I guess the first thing to think about, should you find yourself in a COVID-live situation, first thing you need to do is lock down a house. You need to make sure that you're notifying staff of increased safety protocols. And again, I mentioned the support team. The communication with staff needs to be alerting but not alarming. We need to make sure that the people that are delivering this message to staff are calm and able to communicate in clear and simple language. Good to make sure that your staff receive an email with any relevant information. And what we found was templating information was really helpful, because that meant that when it came to crisis, we just had everything kind of lined up and ready to go. As I said, we're talking after 18 months of experience here in Victoria. So hopefully some of the things that I'm sharing with you are things that will be helpful. In terms of your houses, and again, house service interchangeable, you need to make sure that you've got signage up at entry and egress points so that people coming into the house are aware of the current environment that they're stepping into. And that should probably include some information around the PPE that needs to be worn in that service too. And speaking of PPE, what we have learned is PPE used properly is the key safeguard for your staff. So make sure that the staff know where to find it, they know that they need to wear it, and they know how to wear it. There is a lot of PPE training that's available online, and that will support your staff to understand how to wear it, when to wear it, all of those things. We would really encourage your staff to do this training, not only preemptively, but to continue doing the training regularly. And the training includes some really specific stuff around fitting a mask. There's some really important measures that staff need to understand about wearing that PPE in order to keep them safe. So yeah, maintaining that training is pretty important. Another thing that we would recommend is having an emergency COVID response kit available at your service. So basically that would just give you a small amount of the additional levels of PPE available so that when you have a suspected or positive case, there's an emergency kit that staff can break into so that they have that immediate PPE available while you can then get the additional supplies to them. And to this point, making sure that you have a good understanding of how much PPE each of your services will need in advance, considering how many staff are going to be there on a day, how long can they wear each item for, how long you're going to need the higher level of PPE for. In Victoria, we seem to have very clear protocols around when it needs to be a 7-day quarantine or a 14-day quarantine. So we're able to respond according to whichever one it is. The next thing that we've had to make sure we do really diligently here in Victoria, and also making sure that I do acknowledge that I know we are in different jurisdictions, but I'm talking to you about the experience that we've had. And the next thing is a deep clean. And again, the preemptive here is really important. Make sure you have a relationship developed with a company who can be responsive to your needs. So check that they know the government guidelines for a COVID clean, because the requirements are often different to a standard clean. Even if it is a deep clean, there are some additional things. And what we've found is that we're actually asked to provide a certificate to the Public Health Department here in Victoria so that they can check off and make sure that the correct clean has actually been done. But I think more than that, it's also navigating a deep clean in an operational space is really interesting for a couple of reasons. One is hazmat suits. Most people haven't really come across people wearing hazmat suits, general public or people in our services. So, you know, we've learned to do some things like download pictures of people in hazmat suits so that we have them to show the residents that we're going to have some people coming into your house. They're going to look a little bit funny, but they're coming in to do a spring clean, or, you know, whatever messaging is going to be meaningful for your residents. You know them best. For you, it may be a simple conversation with them, but we have those photos ready to go so that should we think we might need them, they're ready to be used. Another key thing is the minimisation of staff movement. Obviously, where we have COVID in services, we need to make sure that as much as possible, we're minimising people in and out. So we've adopted a COVID rostering principle, which basically means that we have 3 8-hour shifts across any given day, because this means that we just get to minimise the people coming in and out of the house. And it may not work for everyone, acknowledging that. But it's worth thinking about how would you minimise movement in your services? What would you do to make sure that as much as possible you're having less traffic in and out? So when you are having those conversations with your your preemptive conversations with your COVID workforce, make sure that they're aware that there would probably be some changes to your rosters if that is the approach that you choose to take. I think the reason that becomes really important is because one of the things we found is, despite the fact that staff said, yep, absolutely, really happy to provide the support, when it came down to it, the shift pattern changes, the idea of actually working in a COVID positive environment meant that some people did withdraw at the last minute. So as much information as you can give people is brilliant. And I guess, again, I come back to the point that I made earlier, and that is everything comes back to communicating. You've got to have a really good team of people that are able to communicate clearly and calmly. And this includes when you are dealing with a live situation. You need to do things like contact the team each day. The way that we do things is contact people in the morning and the afternoon. We're able to then have that kind of bit of a check-in to make sure staff are confident in the use of PPE, to make sure that they know if there's any data recording that we need them to be doing in terms of symptom checking for our residents, and also so that they feel supported. It can be a really isolating experience. So this 30 minutes out of your day it's going to make the world of difference to how your teams feel when they are asked to work in that environment. The other thing it also gives you a chance to do is check on your PPE stock levels, make sure that there's things like additional cleaning equipment there so that they can be doing regular cleaning of surfaces, but also little things like you're going to have all of your residents home. So you're going to be going through a lot more groceries. So just checking on things like bread and milk. Some of those really simple things make a huge difference to the team on the ground. I've spoken for a while now. The last thing I will touch on is who you would need to inform. Make sure you know who and what your state-based reporting requirements are. We know that there needs to be standard notifications made to the NDIS Quality and Safeguards Commission, and there'll be contact tracing, all of those sorts of things. But I'm now going to hand over to Kim, who will be able to cover that for you in a lot more detail.
Thanks, Ella. At OnCall, the quality team had the role of managing and coordinating suspected and confirmed cases. My key takeaway from OnCall's experiences in 2020 and 2021 is very similar to everybody else on the panel, and that's the importance of communication. That's communication between the employer and the employee, communication between organisations partnering together, and communication with external agencies such as Public Health, NDIA and the NDIS Commission. So starting off, communication between the employer and the employee, it is important that staff communicate by any testing that they have been directed to undertake to their employer. Now, it may not be a requirement in a particular jurisdiction, but it is incredibly helpful when we're trying to keep people safe, and that's both clients and our staff. OnCall direct our staff to let a standard email, which is askquality@oncall.com.au, know when they are undergoing testing. We make them unavailable for work until we receive evidence of their negative test results. Where a staff member is identified as a suspected or close contact or a confirmed case, OnCall undertakes a risk assessment, which identifies staff and clients, including partner organisations, that need to be informed and any additional people that may need to undergo testing. Communication between organisations that are partnering together, so that's you and us, hopefully. As soon as OnCall knows that a staff member is a suspected or confirmed case, we will let others know all the information we have so that people can undertake risk assessments and communicate testing and isolation requirements to impacted people. We have found that the more transparent and detailed the information that is provided, the better we are all at minimising exposure to others. In regards to contact tracing, we have developed an OnCall process that allows us to identify who is impacted and the level of exposure to identify testing and isolation requirements. We communicate, we identify who else, people and organisations that need to be informed of possible exposure, and we give them all the information that they need so that they know what they need to do and for how long. PPE, we determine what PPE is required. This is for our internal sites, and ensure that it is available or supplies needed to be distributed. We ensure that staff know how to don and doff PPE and ensure that required infectious waste processes are in place. And this is what Ella touched on briefly before. It is important that there is adequate signage on display to ensure that when people arrive on site, that they're aware of the infection control measures in place. especially where they may have missed the email you sent them communicating that. Reporting, we need to make sure we identify the reporting requirements to external agencies so we can meet the timelines that are required, which is my next point. Know what the requirements are and what the deadlines are for reporting. So with public health, be aware that the requirements and risk assessments for COVID change regularly. From memory, I think we're up to our 18th version of our COVID plan. In addition, the caseload in public health is likely to grow, and there may be a delay between the identification of a confirmed case and their communication to the organisation. Therefore, it's important that your communication internally between you and your staff, your record keeping and your processes, they're going to be the key to keeping your people safe. OnCall staff know to inform OnCall. This means that by the time we are contacted by public health, we've contained the virus, hopefully, and have infection control measures to protect others, and we have completed all the required reporting. So generally, public health get information from us and a full picture before they understand it themselves. Reporting to the NDIS Commission. A key learning for us last year was that the information we provide to the Commission is de-identified. So they do not provide reference numbers. Our tip is to make sure that you have a record of notifications made to the Commission so that you can identify the case they or public health or the NDIA wish to query. And generally they identify it by suburb. Communication with the NDIA, be ready to repeat the mechanisms that you've put in place to ensure continuity of support. And then finally, work safe. Just be aware of the reporting that's required, and generally speaking, we're able to provide them with assurance that we have done everything that we need to do to contain the virus at the exposure at a site and keep people safe, which is what they're mainly concerned about. Back to you, Troy.
Thanks a lot for that, Kim. That was really good. And Ella, so I guess key takeouts is that clear communication, which is we know is paramount during this time. So yeah, Laura and I will just now have a quick chat around the most important thing at the end of the day, and that's getting workforce on the floor to help support your participants in the event that you have a site that's in lockdown because of a confirmed case, or B, you have staff members, your site's also in lockdown, but as a result of the, you have staff or participants or residents that have tested or going for testing. So two different scenarios, but similar sort of outcomes in what you need to do on site, which is locking it down. But the workforces can be quite different because we know from experience that staff working in precautionary sites, so one where people are off getting tested, is quite different to when we get the positive outcome for either residents or staff. So Laura, I might get you just to start, and then we can go from there.
Thank you, Troy. I'll do a quick intro, and I'm going to flip it on you and ask you some questions because your depth of experience is actually really great to share. So OnCall calls this surge workforce. We already deliver support workers out to industry all the time. That's one of the core capabilities that we offer in any event, COVID or not. When it comes to COVID, the common term that gets used is surge workforce. That means the extra people you need because of COVID. Really honestly, this was an incredibly difficult service to deliver. And it all starts with the honesty about how many support workers were prepared to say yes to go and work with people who were COVID positive. So we'll talk a bit about the precautionary sites, but the rubber really hit the road when a participant, an NDIS participant or a kid in out-of-home care had COVID, and people needed to be prepared to go and deliver that essential service, be a great disability support worker with a COVID positive person in all sorts of locations. Right, they'd never turned up to the site, never met the person. That's an extraordinary ask in the circumstance. We had to survey all our workforce and find out how many people were prepared to say yes to that. it wasn't very many. I think in the end, for both years, we ended up with around 50. By the time we were really dealing with it, that probably went out to a few more who would consistently be prepared to say yes to what were some really difficult circumstances for other providers and for people with disability and kids in out-of-home care. It was all about safety and logistics and incredibly close partnership with whoever we were going in with, because it was absolutely crisis and critical times, and we needed to do everything to keep the residents safe, but also employees safe, because those two things are working in very closely in anything related to COVID. So it didn't always go well, Troy. I think we've had a discussion. We're kind of really happy to be pretty open and honest about some of the lessons, hard, bruising lessons that our employees and us as an organisation learnt along the way, alongside other providers in the market as well. But Troy, you've led over 10,000 hours of delivery of just about every different variation of this. That's large residential sites where there were 30 people. I think in 2020 we had one that had 30 people on site. We'd never been there before, but the Victorian government needed a hand with that, and we've done a few more, right down to single participants, where the NDIS participant, every other provider bolted the second they got COVID. And no matter how much government tells people they have to stay in, that isn't always what happens. And so we're able to go and work alongside that person and their family as well. And then plenty of shared supported accommodation sites, lots of the shared or in old language group homes around Victoria as well. So Troy, given all of that, here's my questions to you. So really, I think let's get very practical, not talk about it in context. The time that the provider rang you or the person who needed help, how did that phone call go, and what was the kind of response you had to give to them?
Yeah, thanks, Laura. So we learned a lot in the last 18 months. So I think I can peel back the layers and we start at the beginning, which is where, when first hit our desk when we got a call for someone who tested positive for COVID, but was not living on site, been removed, and was living elsewhere in a unit not attached to where we would send staff. Normally, as we do, as a labour hire provider, is no problems. We can come in and support. We didn't ask too many questions because we didn't know too much. We thought it was all okay. Staff turned up. 3 days later, we get a phone call to say that your staff all now need to go get tested for COVID because the person who had tested positive actually lives in a dwelling which is upstairs, which initially we were told was not connected to the house, which turns out there's no doors to lock off. And as a result, Kim, you'll be able to give me the exact number, but I think it was around 7 staff of ours all tested positive I'm getting a nod from Kim. Yes, so it was 7 staff tested positive to COVID. So from that point on, we made it clear in our efforts to support people around getting the information that we need to provide a safe environment for our workforce. Thankfully, our workers are okay. And they're all working again now, which is great, but the risk was huge to us as an organisation at that time. And we knew if we were going to go down this path to support people in positive, that we needed to ensure that we had all the information to provide a safe environment for all stakeholders. So now we do a full risk assessment every time we get a new approach to support people in a positive environment. We understand we have a workforce that's trained. In that the surge workforce, Laura mentioned the 50 workers that we have. Just to give you that in context, our workforce at the time was around 2,000 disability support workers. So you can understand that not your workforce will disperse. Back then we didn't have the vaccine, and it was very unknown, so people were scared. Ella's point earlier on the communication and having the people that can deliver the messages in a way that's not threatening to your workforce is going to be key through this situation. We have other providers that we already developed specific training for them, for their organisations. So we have workforce ready to go in the event that they need them. We do inductions for other providers that wanted us to induct and actually, almost go through a mini recruit for them, for their surge workforce. So every organisation is different that we support, but it's typically crisis driven because no one knows they're going to have COVID until they've actually got it. So preparation is the key for sure, Laura.
Yeah, I think that's right, Troy, and I trust they won't mind us sharing, but that was Life Without Barriers, who we work with often. And it was a really great example that they developed really fantastic online training. They gifted it to anyone who wanted it, but including OnCall. And we were able to access that and make sure it was highly relevant to disability support workers. The same way that the risk assessment, the COVID risk assessment, and trying to ask the right questions to get the right information. That's what that risk assessment's about. We have freely shared that out into the sector and can do the same. Megan, if people get in touch with you, very happy for that to be shared widely. It was really clear that it didn't matter who you were, where you were, if it needed to be done and needed to be shared, providers were very collaborative. And I think it was really critical to the success overall, or just getting by. I don't know if we'd go so far as success. We all got through it together, that's for sure. Troy, you might have already said it, but maybe there's another one. What was the hardest lesson in the middle of surge workforce? And it's okay if you say it was someone else's hard lesson, by the way.
I think the hardest thing for us is, when the initial one, when our staff tested positive, we knew right away that we had a problem, something needed to change. So that was the biggest lesson around ensuring that we got the information that we needed from the providers to provide a safe environment for our workers. We found even after that time, people were still hesitant to say if their participants or residents were testing positive or testing or not, because they were scared about their reputational risk if the media got a hold of it, because at that time it was quite raw. But for us, obviously everything is kept highly confidential. We just needed to make sure that we ensured a safe workplace for our staff at the same time. So we must ensure that we get all the information in detail to maximise our efficiency to provide the best workforce to the providers. And a workforce that's not going to turn up and just walk away when they open the door because they find out they're walking into something that weren't expecting.
Definitely. I reflect that we had a very close relationship with public health. So we talk about risk, but it's dynamic risk, and public health have, the clear black and white set of rules that they publish on the internet, and then they have the situational rules for things that are different. And people with disability with heaps of support needs is different to the public health guidelines on the website. And we had to have some really clear risk-based conversations that balance the risk of COVID and infection with the risk of people with disability not getting the support that they needed. And I think in addition to the early on lesson and how we were great disability support, one of those things is we learned to bring medical oversight in and work side by side. And Victoria generally learnt that lesson early on. Let us be great disability support. We obviously need to do that safely and know how to do it. But generally in future outbreaks, they also, where it was a substantial outbreak, there was a clinical oversight of one of the local area health commands. And they were on site every day doing PPE spotting, training, checking, updating. And it was that combination that probably worked the best in those really big outbreaks that were quite challenging for the providers that we were supporting to manage as well. Hey, it's easy for us in our ivory tower in the office, Troy. What about the support workers? How did they go delivering in such extreme circumstance as well?
Oh, from the support workers, we had the full spectrum, but what we found, the way to keep them engaged is just communicate. We have a dedicated COVID allocation team in the office that's daily in touch with that workforce because it's quite small and niche. We put a lot of effort into supporting them and making them feel valued. Really, they were the heroes of the organisation. They continue to be for the services that we still support. It hasn't stopped. We're still doing it. So they're really treated on a pedestal in our eyes and heroes, and we make them feel like that as well to keep them engaged, because there's such small numbers of those people doing the work. It is tough because they can turn up, like you said, we've done 30-bed operations where the day one there's only 2 people on site, and there's no cooks, there's nothing like that. And it could be as simple as, okay, we've got 30 meals, they've delivered frozen meals to feed everybody, but you've got 1 microwave. And when one meal takes 7 minutes to be microwaved, do the math on how long it takes to feed a whole entire 30-bed facility. So so workers can become disgruntled, but at the same time, because we can, we've learned all this, and we can move workers from site to site as the COVID sites shut. We get better at asking the right questions and experience. And this is where it comes back to sharing experiences with your partners, not holding anything to yourself, because there's no benefit to that when COVID hits. We're all about being open and transparent and sharing our experiences. But coming back to the workforce, it's just about really showing them that they're valued, listening to their needs when they say we need more microwaves or we need some assistance, as simple as it can be, can make a huge difference. And in that case, we got more microwaves in, and we actually got more workers in who were just doing the meals for the day, for the duration of that 2 weeks that we had that program.
We learned a few hard lessons and a bit of humour along the way. We had hotels for heroes, do you remember, for workforce? And that worked brilliantly because people could isolate and remove the fear of where that was relevant of housemates or their family in between shifts in a COVID positive site. But there was at least one occasion where a guy got checked in the wrong spot and got quarantined for 2 weeks. We had to work out how to get him back out again. He was very patient with us while we sorted that one out. Do you remember?
Yeah, that poor gentleman actually checked himself into hotel quarantine instead of hotel for heroes. So it was where they were coming in from international borders in the city. So yeah, we hope he's out. Yeah, he's definitely out. I'm just conscious of time. We've only got a few minutes left, and we've had a few questions come through. So thank you, everybody, for your input today. I'll just got these ones come through. One provider's asked, we have aged care homes as well. Do you know if this is any different to disability? So Laura, you probably...
Yeah, I think it's the same than different, the same way people often mistake our industries and sectors to be not that dissimilar because it's people helping people. The size of aged care, the regulation and the vulnerabilities of the people who live there. I think we'd be more likely to have things in common for people with cognitive impairments in the same as people who are older with cognitive impairments, the type of dynamics of the support. And then not dissimilarly, where people are stationary, they have a physical disability, and the way that you might need to go about that support. Ultimately, the regulation, the reporting, the need to have different workforce are the same, but the execution of it from when we've listened to aged care providers, Troy, is really different, tends to just be at a way bigger scale in aged care because of the size of a residential aged care facility. For clarity, we didn't assist anyone in aged care. We're not a registered aged care provider, but we did have a few contact us for personal care assistant surge workforce, but usually we were already maxed out with the other surge workforce we were doing at the time. So like everything between disability and aged care, on the surface it looks the same, but no, undoubtedly the people we're supporting and the regulations and how we do that, it's just same but different.
Yeah, and probably I've just got time for one more question. Has the COVID vaccine had an impact on your ability to provide workforce?
Oh, yes, it definitely did. Now, OnCall's in an incredibly fortunate position that we have more support workers than OnCall needs, and we never have enough support workers for what the industry needs. We probably had a few people opt out, but in the main, we had vast majority over 90% of the people, in fact, 100% of the people who were actively working with us went ahead and were vaccinated by in the end, the public health deadlines down our way. And I know in Queensland, Megan's put an awful lot of effort that every one of our workforce there is also vaccinated and ready to go. However, there were people who really found the vaccination conversation incredibly difficult. And we've heard from providers right across the sector that everyone's taken a hit on who's available, but also the ability to bring people on quickly as well in an environment that, vaccination or not, getting great disability support workers is already a really challenging thing to do. So it was hugely difficult. It took a tremendous amount of effort to support our people across the line in terms of the deadline. And we did take a little bit of a hit, but in the end, we got there. And every provider in the industry has told us they've all had a bit of a drop in the available workforce. Usually the people around the edges who worked a little bit of the time, they've just kind of put their hands up and opted out in some instances. But we're a startup in Queensland, and just like in Victoria, that means we've landed 100% of our workforce vaccinated, Megan, I believe. But people can get in touch with you to double check that and just make sure that we're ready, willing and able to assist no matter what.